All right, Dr. E. First question this week is my son is 12 years old. He has always had SM. We had a meeting at school, and the staff indicates that he is pretty shut down, does not interact with his peers at all. They recommended he be tested for autism. Yet at home, our son seems fine. What do you think we should do? Do you think we should get him tested?
Thanks, Brandon. This is a great question, and I get asked this question, I'd say, almost on a daily basis. First of all, a child can have both autism and SM, and I know sometimes there's confusion on that you can't have SM and autism, and that is just not true. We definitely see individuals that have both SM and autism. You have to remember that SM is a social communication anxiety. It's not just about the mutism. In fact, that's just a symptom. And hence, some of the symptoms of SM can be mistaken as autism. For example, a shutdown, overwhelmed, and non engaging child who is socially withdrawn may also be a child with extreme social anxiety or anxiety from other sources, hence the Y's of SM. So I can't state whether your child has autism or not, but a question to ask is, what is your child like at home when comfortable? When a child is on the spectrum, their autism symptoms exist in all environments, not just one or a select environment such as school. And that's really important to know because even though symptoms may be more extreme in school, for example, more anxiety, if they truly have autism and are on the autism spectrum, they will manifest autism spectrum symptoms even in their home, comfy environment. The most typical social communication symptoms we see in teens with higher functioning autism are problems forming friendships and keeping friendships, mistaking social cues or body language, misinterpretation of conversations, being incredibly concrete and very, very literal in conversations, finding it easier to form friendships online because it's a much less body language involvement online and it's more text, poor eye contact and very inconsistent eye contact. Sometimes these individuals will express they just don't fit in. They don't feel like they can make friends or have friends, and it's an actual frustration. Many have little interest in friendships or they want or they don't want to be around same age peers. They will literally say, I don't care. I don't really need to be with anybody. I don't really want any friends or just leave me alone. And they will possibly even just avoid opportunities to be with other peers. And it's more than just a social anxiety because individuals with a social anxiety will have an innate desire to want friends, but it's just really difficult to have friends. So, most individuals on the autism spectrum, of course, it's a spectrum and it ranges, really have difficulty. It's almost as if it's a puzzle they can't figure out how to interpret the body language, what people are saying, how to start conversations, keep conversations going. It's a puzzle. So, even when they're comfortable, it's still a puzzle that frustrates them a lot. And you can see avoidance and increased anxiety and so forth. And depression can also result. So, again, what is your child like at home? Does he have the above symptoms? You mentioned he can be fine at home. If he is a socially appropriate 12-year-old who doesn't manifest these symptoms, he has friends, is appropriate with friends, and even if he doesn't have regular friendships because the opportunities haven't been there because of the selective mutism or social communication anxiety, he has appropriate skills. So maybe with a sibling or a cousin or with you, there is appropriate skills there. But is he inappropriate? Even if mute, he can have appropriate skills, right? However, if there is any doubt, I do recommend autism testing. The ADOS, ADOS, and the ADIR are the gold standards of testing and can provide you excellent information on whether or not your child has autism and their present social communication functioning. It can also help rule in or out autism, which is really, really important because it can direct you to more appropriate services, accommodations, and interventions that are autism specific. But if he doesn't have autism, It can point you in a whole different direction into what you need to look for in terms of why is your child shut down and not engaging with peers in the school environment. So, I can't tell you whether to have your child tested for autism. I can't tell you if your child has autism, but I can tell you that if there is any doubt, you may want to consider it because it's only a win win to get that information. So, it helps you know where to go.